So I'm delighted to introduce to you today Dr. Michael Cannel, who we've had on Live Well with Air before. He's a holistic doctor in Redbourne, and he's going to talk about practical health to prevent cognitive decline. So welcome, Michael.
Thank you very much, Olive. I feel very passionate about this, no doubt because I've got grey hairs as well. We're talking about practical help to prevent cognitive decline, basically how to optimize brain health. Really, it's something which we should be concentrating on when we're in our 50s, if not earlier, because unfortunately, about 20 years before we might be come to the attention of a doctor because we're forgetting more, that's when things tend to be deteriorating. So when you're offered a checkup colonoscopy by your GP, which is to check up your colon maybe when you're 50s, you should also actually be thinking about, how do I optimize my brain health? Unfortunately, as an ex-GP, although I still work on some occasions as a GP locum, we're all involved in compartmentalizing body and minds. And so if you see a cardiologist, they are not interested in cognitive health or the effect that some drugs may have on your brain. So we're all in compartments. And my job as a GP, but also as a holistic doctor, is to look at the whole person. And why I feel passionate about this is for a start, the WHO said that preventable disease, those things that we can prevent, amount to do as much as 70%, and they're due to lifestyle or life choices and environmental factors. And this includes cancers and Alzheimer's.
Wow. So could you do a little bit of an explanation about cognitive decline and the types of Alzheimer's?
I mean, why again I feel so passionate about it is that dementia now is the leading cause in the UK pre-COVID of death. It's overtaken cardiovascular and other causes. And dementia is an all-embracing word, but Alzheimer's is the ones we tend to talk about, because 80% of dementia, which is when you're losing some of your cognitive faculties, 80% is due to Alzheimer's. And Alzheimer's is a particular commonest type. And that is the type, I suppose, I'm mostly concentrating on. You can have other types of dementia from Parkinson's disease and other brain trauma and other causes, which is not really the subject of this discussion today. But the important thing is that when you see a doctor and you're worried about your memory, which is usually the way it presents, to do with Alzheimer's, they will be thinking about sending you off to a memory clinic where you are assessed to see if you've got what we call minimal cognitive impairment. That's a definition why, a bit like pre-Alzheimer's, have you got something where we can record and measure a definite impairment. But what you have to realize that as much as 10 or 20 years prior to that, patients, including myself, often have an awareness that things are not quite as good as sharp as you were in your 40s or 50s. And that can precede by as much as 20 years before you go to the doctor.
And what's the difference between subjective cognitive impairment and minimal cognitive impairment? Well, they're sort of terms I don't register really.
Well, the minimal one is what the doctor's trying to pick up, and he will do a memory test and maybe refer you. But the subjective one is when you have the feeling, look, I used to be much better at bridge. I used to be able to do all those high-powered mathematics. You know, I had a PhD in mathematics, and now I'm finding it I'm not as sharp as I used to be. That is the subjective. That's when you feel you're not as sharp as you were.
Gosh, I've had difficulty remembering my maths degree, but I didn't do a PhD in it. Okay, so you talk about lifestyle factors and lifestyle medicine and functional medicine are talked about these days. Can you tell us a bit more?
Yes, I mean, I'll show you this book, whether you see it on, I'm not advertising.
Yep. Just a little bit further forward. That's perfect, thank you.
This gives you the example of what we're talking about. sleep being right at the top, and we'll have a whole session on that. I think Olive's planning one on the 19th of March.
Absolutely.
It's so fundamental. The others, what you eat, how good is your diet? Is it Mediterranean focused? Do you have lots of vegetables and rainbow coloured vegetables and fruit? And then you have, have you learned to relax? So that's the bottom one. I'm doing it in reverse order.
That's all right. That's fine.
Do you move a lot? Do you move enough? It's not just walking. It's also, if you can't run, then you think about doing exercises, sitting down in your chair, lifting things up and down, or just getting up and out of your chair. All these are things to keep the strength going. You concentrate on balance, maybe Pilates or yoga. So those are the 4 pillars, as he describes in his book, and many other writers do. Quality of sleep, not just the quantity, but the quality.
Absolutely.
How do you relax? Because all chronic diseases have a component which is involved. Stress makes you worse. All types of stress. Some stress we generate ourselves because we're workaholics all the time. We don't have good boundaries on our rest and work and sleep and having fun. So we can all fall down on that. Basically being creative and using a whole person. And then coming down to what we eat, I talked about the Mediterranean diet, having lots of berries, particularly. There's very good evidence for cognitive health, having more berries, blueberries, blackberries, raspberries, having more seeds and nuts. They're full of minerals and vitamins and fiber. You must have a lot more fiber. Having more fish, very good evidence that omega-3 and fish, really good for cognitive health. That's because all our cells, particularly our brain, is made of 70% is made from good fats, and good fats are particularly in fish, particularly, and then of course the plant-based foods. And unfortunately, not having much of that sugar, that's the tends to be a baddie for our health.
And if you go back to the Active in Redbourne site, you'll find Mike's previous talks about nutrition, which you'll find really interesting, and we'll give you a bit more detail of what he's just been talking about. So would you like to add anything extra to the list?
Well, the other thing which is often left off, and I've become very interested in this, unfortunately, as we live in this world which is polluted, and there's more and more plastics and heavy metals and organic solvents, and maybe your house has got molds. All these things, unfortunately, over time, we call them toxins, but they affect the workings of the mind and body. And unfortunately, one of the big toxins, you have to say this, is alcohol. And I know in this time of lockdown, we all need a bit of wine, and it does say somewhere in the Bible, a little bit of wine is a good thing. So I'm not against wine, but you need to have the awareness, anything more than a little bit is toxic to the health of brain and body. The body has to repair itself. Every time you have a drink, it takes about 8 hours to sort of recuperate. And it does actually kill off cells in the brain. And the brain then has to repair itself. So be careful.
And also, when you hear about sleep in March, you will find that alcohol before going to bed, doesn't actually, although it knocks you out, doesn't do much for the quality of your sleep.
Absolutely, absolutely. And even other things. Unfortunately, if you've had a job where you've been having to paint or decorate or clean, these cleaning solvents, something else I listened to recently, people who love burning candles. Well, if the candles are made of paraffin, which majority are, long-term exposure to paraffin is not good for the brain. Now, if you buy candles made from beeswax, that's a lot healthier. As far as I know, there's no hazards. It's like pilots, unfortunately, there's something called a syndrome, aerotoxic. It's to do with the circulation of air in the cabin. It might be to do with the airline fuel, or we don't really know. But there's real syndromes and proof that this damages health. We've learned recently in the news about brain trauma, people who enjoy football or boxing,
Yes.
heading the ball. These have a real link. And chronic infections we've talked about, we've mentioned, even something like infection in the mouth. We could sometimes get away with having gums that are soft and bleeding, and we don't think they're much, we don't have to worry about them. But there's a definite link between health of the mouth and gums and the brain. So teeth cleaning is very important. Our gums cleaning particularly.
Good stuff. So I've heard about Professor Dale Bredesen and YouTubes and books, and why are his published research and books so important in giving you some useful tools?
Well, this was a turning point for me about 5 years ago. This is one of his first books. Now, he's an American professor from California, but he's spent his whole life researching as a medical neuroscientist on drugs for dementia.
Right.
And for 30 years trying to come up with a useful drug, he realized that actually there's at least 60 pathways that lead to dementia in the brain.
Wow.
And probably more like 100 or more. And you can't devise a drug that's going to hit and target and change and modify 60 pathways or more. And in fact, most of the drugs, even the ones that are now available, have, in the long term, have proved not to work or have had too many side effects. So his approach is one looking at the holistic approach. How do we optimize all these different pathways in the brain? And if you do that, he has proved over about 5 years, they've published many papers, including 200 written up case reports of people who were unable to work because of early Alzheimer's. And by following his protocol, they've got back to work. And I think why I found this so important is that you can give hope to people. I think there's this message that if you have early dementia, it maybe can't do anything. It's never too late. If you find somebody who's got cognitive impairment and you discover their blood sugar is too high, they've got either diabetes or they've got pre-diabetes, getting that blood sugar down is fundamental and can make a big difference. Stopping your alcohol can make a big difference. Eating healthily can make a big difference. Having good sleep, looking at your stress levels. And this is what his research has shown. And he's come up with these 5 basic types. One is inflammation. If it's type 1, as he calls it.
Let me just ask you, is this different types of Alzheimer's?
Yes.
Okay, fine.
He's classified it as, there's 2 main types, but they overlap. So one is inflammation, driven by inflammatory pathways. And if there's inflammation because your gut is inflamed, because you've got abnormal bacteria in the gut, or you've got abnormal bacteria in the mouth, or there's other causes of inflammation, then that promotes it. If you've got deficiencies, the other type he calls is atrophic. But if you have a deficiency in vitamin B12, your thyroid isn't working well, you're low in zinc, you haven't got enough magnesium, these are what he calls the atrophic type. And there's very good evidence that getting your vitamin Bs up, for instance, or your vitamin E up is fundamental. And then you have another type where it's primarily due to your sugar load being too high. And there's a more difficult one to treat where it's due to toxicity. And he's found a big link with molds, which might be in the house. This is often overlooked by doctors. If you've got molds anywhere in the house, deal with the problem, because it's not just the brain that's impacted by molds. They release toxins. So that's an effective thing on your chest. It's something which is often forgotten about by doctors, either in the workplace or in your home.
And is stress also connected with some of these types?
Yeah, unfortunately, if your stress levels are high, it impacts recovery on all levels. So whether it be your physical, your body, or your mind, stress pathways tend to be what we call pro-inflammatory. They enhance inflammation in the
Okay.
body. So every time you practice relaxation or breathing techniques, I think in the past Olive's talked about breathing through the nose or the diaphragm, deep breathing, sort of yoga type of breathing, that's fundamental.
Okay, so this is really sounding really encouraging and really exciting, and uh, this doing this for the local community is great. But do you think this is getting sort of any wider coverage?
It's beginning to. America always is, in many ways, is ahead of us. In other ways, it's behind us. But in this case, there's more holistic doctors and doctors interested in lifestyle and functional medicine than there are in this country. But I am encouraged that younger doctors are now thinking this way, and some GPs, there's several I know in St Albans who are more this way inclined. So it's beginning to get traction. You can look up Dale Bredesen's work on YouTube if you type in his name. There's other resources I can put on Facebook to do with his work.
That would be great.
Polo Health Recode is on Google. If you put that in, APOLLO Health Code. And I will mention a diet book. I've got one somewhere on this shelf which talks about diet and recipes for dementia. If you've got early dementia, this was written by a professor at the University of Surrey who's done a lot of research as well in nutrition. And she's done a recipe book actually on how to optimize brain health.
Right. And I think one of the messages we might say is, going back to what Mike was saying about when you're 50 years old, I think the first signs of you might not be remembering quite as well as you thought. Instead of what most people will do, I think, is hide it and try and avoid it. Whereas if you take some of Mike's advice here, you can actually change it. And it's much easier to change when you're younger. Would you agree with that?
Absolutely. And of course, I've forgotten to mention brain exercises and crosswords and word puzzles and number puzzles. Yep. Anything like that. And in terms of movement, you know, it could be playing table tennis. It could be doing dancing. It could be doing exercises in the kitchen whilst you're cooking. Yep. You don't have to think about limiting yourself to the gym, which is just as well at the present time.
Yes, absolutely. So any last minute messages you would like to give the audience, Michael?
No, I think it's just there is hope, and that we have the power within ourselves to make a difference with the help of other people. We always need help from the community and each other. Like in this present time, the pandemic, it's all about, and that's what all this community is all about, helping each other.
Great. And don't forget to come back on the 19th of March, International Sleep Day, and we've got a whole day webinars on sleep and different aspects of sleep. And Mike is coming back to talk about what he touched on this morning, which is about the effects of sleep on Alzheimer's. So thank you ever so much, and we'll speak to you soon. Bye-bye.
Bye-bye.